According to the CDC, most Americans are not getting the recommended amount of 7 to 8 hours of sleep each night. Melatonin is a common over-the-counter supplement, often used to help with insomnia and getting a restful night's sleep. We talked to Dr. Bonnie Herr with Community Health Partners about what you need to know about melatonin and if it's right for your lifestyle.
I feel like during this time, especially during this pandemic, I think everybody has dealt with insomnia in some way, shape, or form.
1 in 3 people have brief insomnia, which might include trouble getting to sleep, staying asleep, and waking up too early.
The biggest thing is usually what causes insomnia is more of maybe mental stimulus or stressors that are going on, more behavioral. And so the best thing is pretty much behavior modification, making sure you go to sleep at the same time, wake up at the same time. Melatonin is an option.
Melatonin is a hormone that is secreted from a gland in our brain.
It helps to regulate our circadian rhythm. You'll see higher numbers or higher levels of melatonin when it's dark and then lower amounts when there's light outside.
Circadian rhythm is your sleep-wake pattern over the course of a 24-hour day. Doctors say it's essential to manage this rhythm for a higher quality of life.
Our body replenishes and rejuvenates and fixes and is able to rest and rejuvenate cells. So that's when we mainly recover, is mostly at nighttime.
Dr. Herr says melatonin can be used in various ways to achieve an adequate sleep-to-wake cycle.
Jet lag is mainly one of the main ones. If you're traveling, different hours, time zones, that will help you kind of reset that circadian rhythm. The other option is for shift workers. So if you're working nights versus swing shift.
However, she states melatonin is not a cure-all.
It's better if you use it more short term. Some individuals do use it long term, but that does provide some potential side effects long run. Not necessarily an addictive, I believe. It just becomes more of a dependence. You have a harder time falling asleep without the use of it. But if not taking it, it doesn't cause any withdrawals. It's just you won't be able to sleep.
It's important to talk with your doctor as the supplement can interact with certain medications.
Some of those medication interactions are those who may have blood pressure issues. It can cause elevation in blood pressure. If you're diabetic, it can cause your sugar levels to be high. If you're on anti-seizure medications, it can lower the threshold, so increased risk for seizures. Also, if you're immune compromised or any way, it can also increase your immune system, which can cause flare-ups. And then one more important one is if you're on any anticoagulation medication, so blood thinners, it can actually cause your blood to thin even more, putting you at risk for bleeding.
And if you're looking to hit the pillow naturally, Dr. Herr has other recommendations.
Your mind is just like any other muscle, and so it's important to fatigue it. So physical exercise, brain stimulus at nighttime, you want to decrease that. Other ways to look into this is doing meditation, yoga, the physical exercising. You can try essential oils and various other ways and techniques to kind of just relax and get your body ready for bedtime.